Welcome to our exploration of the biomechanics of human bone, focusing on growth, development, and the impact of exercise and weightlessness. In this video, we'll dive into how our bones change over time, what happens when bone health declines, and the critical role of lifestyle choices. Whether you're a student, healthcare professional, or simply interested in your own well-being, understanding bone biomechanics is key to preventing disorders like osteoporosis. Let's start by looking at what osteoporosis is and why it matters to so many people around the world. Osteoporosis is a disorder that involves decreased bone mass and strength, making bones fragile and more likely to fracture during everyday activities. It often begins as osteopenia, a condition marked by increased osteoclast activity and reduced bone mineral density. This means the bones lose minerals faster than they can be replaced, leading to a gradual weakening. Osteoporosis can cause significant pain and limit mobility, impacting quality of life. Understanding how this condition develops is the first step in learning how to prevent it. Before osteoporosis fully develops, many people experience osteopenia. This early stage is characterized by a predominance of osteoclast activity, which means bone is being broken down faster than it's being rebuilt. Reduced bone mineral density at this stage is a warning sign. If caught early, lifestyle changes and medical interventions can help slow or even reverse bone loss. Recognizing osteopenia is crucial for preventing the progression to osteoporosis. Did you know that about 50% of adults in the United States are affected by a musculoskeletal disorder? Treating these conditions costs nearly $213 billion annually. Additionally, over 100 million adults in the U.S. are living with diabetes or prediabetes, both of which can further impact bone health. These statistics highlight the widespread nature of bone-related disorders and the importance of prevention and early intervention. Osteoporosis doesn't affect everyone equally. There are two main types. Type I, or postmenopausal osteoporosis, affects about 50% of women after age 50. Type II, known as age-associated osteoporosis, impacts most aging women and men. The risk increases with age, and women are particularly vulnerable after menopause due to hormonal changes. Understanding who is at risk helps target prevention strategies more effectively. Globally, the prevalence of diabetes has nearly quadrupled from 108 million in 1980 to 422 million in 2014, according to the World Health Organization. This surge in diabetes cases is significant because diabetes can negatively affect bone health, increasing the risk of osteoporosis and fractures. These global trends underscore the need for public health initiatives focused on bone health and chronic disease prevention. While osteoporosis is often seen as a disease of aging, younger people can also be affected. The female athlete triad is a condition seen in young women, especially athletes, and involves three key factors: low energy availability due to disordered eating, menstrual dysfunction such as amenorrhea, and diminished bone mineral density. This combination can lead to early onset osteoporosis, highlighting the importance of balanced nutrition and healthy exercise habits at every age. Let's take a closer look at the female athlete triad. This condition is characterized by low energy availability, often from restrictive diets or excessive exercise, leading to menstrual dysfunction and ultimately decreased bone mineral density. Without intervention, this can result in osteoporosis even in young, otherwise healthy women. Early recognition and treatment are essential to protect bone health and overall well-being. Regular exercise is one of the most effective ways to prevent and treat osteoporosis. Weight-bearing activities during childhood and adolescence help optimize peak bone mass, setting a strong foundation for lifelong bone health. Even as we age, staying active can slow bone loss and reduce the risk of fractures. Activities like walking, jogging, and resistance training are especially beneficial for maintaining strong bones. In addition to exercise, several other strategies can help minimize bone loss. Hormone therapy may be recommended for some individuals, especially postmenopausal women. Ensuring adequate intake of dietary calcium and vitamin D is crucial for bone health. It's also important to avoid smoking and limit excessive consumption of protein, caffeine, and alcohol, as these can all contribute to bone loss. Osteoporosis significantly increases the risk of fractures, especially in the hip, spine, and wrist. These fractures can occur from minor falls or even simple movements, leading to pain, disability, and loss of independence. Understanding which fractures are most common helps us focus on prevention and early treatment to maintain mobility and quality of life. Consequences of osteoporotic fractures go beyond the initial injury. Many people experience chronic pain, reduced mobility, and a loss of independence. Hip fractures in particular can be life-altering, often requiring surgery and long-term rehabilitation. Preventing these fractures is a top priority in osteoporosis management. Today, osteoporosis is treated with a combination of lifestyle changes, medications, and sometimes hormone therapy. Medications can help slow bone loss and even promote new bone growth. Regular monitoring and follow-up with healthcare providers ensure that treatment is effective and adjusted as needed. Let's look at some of the most common treatment options available today. Several medications are available to help manage osteoporosis. These include bisphosphonates, which slow bone loss, and newer drugs that can stimulate bone formation. The choice of medication depends on individual risk factors, age, and overall health. It's important to discuss options with a healthcare provider to find the best approach for each person. Beyond medication, lifestyle adjustments play a vital role in managing osteoporosis. This includes maintaining a balanced diet rich in calcium and vitamin D, staying physically active, and avoiding habits that can weaken bones, such as smoking or excessive alcohol intake. These changes not only help slow bone loss but also improve overall health and well-being. Regular monitoring is essential for anyone at risk of osteoporosis. Bone density tests such as DEXA scans help track changes in bone mass over time. Early detection allows for timely intervention, which can prevent fractures and maintain quality of life. If you're concerned about your bone health, talk to your doctor about screening options. Nutrition plays a foundational role in bone health. Calcium and vitamin D are especially important for building and maintaining strong bones. Dairy products, leafy greens, and fortified foods are excellent sources. For those who can't get enough through diet alone, supplements may be recommended. Good nutrition supports all other prevention and treatment efforts. Physical activity is one of the best ways to strengthen bones. Weight-bearing exercises such as walking, running, and resistance training stimulate bone growth and help maintain bone density. Even simple daily activities can make a difference. The key is to stay consistent and choose activities you enjoy, making it easier to stick with a healthy routine. Certain lifestyle choices can increase the risk of osteoporosis. Smoking, excessive alcohol consumption, and poor nutrition all contribute to bone loss. By avoiding these risk factors and making healthier choices, you can protect your bones and reduce your risk of fractures. Small changes can have a big impact over time. Managing osteoporosis is a team effort. Support from healthcare providers, family, and community resources can make a big difference. Educational programs, support groups, and online resources offer valuable information and encouragement. Don't hesitate to reach out for help if you need it. Bone health is a lifelong journey. Sum up: osteoporosis is a common and serious condition, but it's also preventable and manageable. By understanding the risk factors, making healthy lifestyle choices, and seeking regular medical care, you can protect your bones for life. Remember, it's never too early or too late to start caring for your bone health. Thank you for joining us on this journey. Stay strong, stay healthy, and keep moving.